Welcome to this edition of AFMC.
I'll tell you how I got better. I'm
Glad to be here.
But a mission to
Delivery of
improve.
I think that we're going to talk about everybody's.
Arkansas is the second highest prescriber.
Welcome to this episode of AFMC TV. I'm Robin Ledbetter. Thank you for joining us. Today I have with me Dr. Huda Sharaf. She is the medical director for the Pat Walker Health Center at the University of Arkansas in Fayetteville. Dr. Sharaf, thank you so much for joining us.
Oh, it's my pleasure. Happy to do it.
So we're talking today about integrated behavioral health. Tell me what does that mean, and what is Pat Walker doing?
Sure. So, it's a topic that I'm very, very happy to discuss. So integrative behavioral health it's a model that basically blends into primary care. And so it's a mental health resource that's typically housed in a primary care clinic, whether that's family practice or internal medicine. And it's meant to offer really accessible and almost sometimes even same day mental health intervention. The reason this is so important is because, as we know, this is a model that takes care of the whole person, not just their physical health, but their physical and mental health. So it's basically a collaborative treatment plan for the patient. The patient benefits greatly from that. And why this is so important is because it allows for timely visits, timely care. Sometimes even if care can be even immediate, if someone's having some immediate crisis issues, increases access. And in primary care settings, mental health diagnoses are very, very common. I would say depression, anxiety, and insomnia are at least in the top 10 most common diagnoses that we see in primary care. And so it made perfect sense for us to start this program. It's been about 8 years now.
And is your organization one of the only universities in the country, or are you seeing this as a moving trend?
So initially, when we started this in fall of 2015, we were perhaps the only campus in the country. At the very least, we were one of very, very few campuses in the country that were offering this type of resources to their campus communities. That's changed. Obviously the push and the resource has become more popular. More people are receptive to starting these types of programs. We were very fortunate in the fact that we have Dr. Anna Bridges, and she's a PhD, obviously faculty member here on campus. And she helped us pilot the program. She helped us build the program. She really was our resource and our guide through all of this. Since most of us, physicians and APRNs at Pat Walker Health Center, had really never used that resource. We had a couple of physicians that had used it at community clinic here in Fayetteville and realized the value of it. And so they also helped us. But the majority of us, this was all really new to us. All we knew about was traditional counseling.
And is it just for students? Is that the target, of course, being on a college campus, or do faculty and staff also kind of are a part of the model?
No, it was key for it to be accessible to students, faculty, and staff members.
And what are some of the challenges that you guys have faced for it?
So initially, right now, when we started out, Dr. Bridges helped us in the fact that it is a resource that's staffed by psychologists, but psychology interns. These are PhD students here at the University of Arkansas that have an interest in perhaps pursuing integrated behavioral health as a career. And so with obviously Dr. Bridges' support, we've been able to have those grad students in our facility. Now, in the beginning, we were really limited. We would have like one student. Maybe we were lucky to have 16 hours of IBH a week. Thankfully, more and more grad students have become interested in this as perhaps a career. And so we've been lucky to be able to grow it. Because in the beginning, we would have we'd have one grad student 16 hours and they'd be booked for 2 to 3 weeks. And we're like, no, that's not the model. The model is to offer, same day handoffs from a medical provider to a psychologist. We didn't want it. We wanted to strike while the iron's hot, while patients were in our facility and they needed immediate quick intervention. to hopefully help alleviate some of those mental health symptoms. But thankfully, again, through Dr. Bridges' support, we've been able to now have, at times, the last several years, have 2 grad students, which gives us at more than 24 hours a week. So
That's really incredible to see the program grow. And I am curious. We hear about depression rates among that age demographic of a college student on the rise, and especially post-COVID. Are you seeing that within the student population that you guys serve?
Oh, absolutely. I mean, absolutely. And we see that anywhere from incoming freshmen through seniors to grad students. But again, we see it from our campus community as well, faculty and staff members. I mean, stressors are not unique to an age group, right? And so we have seen that. We saw COVID take a toll not only on students, but faculty and staff. Students that unfortunately were isolated during COVID, the way that they had, traditionally gone to school and gone to college and socialized, and that all changed. We had faculty members that had to pivot literally overnight from traditional learning to remote learning, and all the tech that goes along with that, added layers of stress. So, and I think that we'll continue to see the ripple effects from COVID for students that were in junior high and high school that went through it and now coming to college. But in general, life's stressful. And every year, independent of COVID, every year we see an increase in the number of people that present to our clinic with mental health issues. And we're not unique. I mean, primary care settings in general have been doing this for years. And now it's just trying to be lucky enough to have resources available, and lucky enough to have psychologists that are really open to this idea of integrating with medical professionals and medical providers, and having a team approach.
And what does this look like long-term for integrated behavioral health? Is this something that you see sticking around? Is it kind of a permanent way of doing things within the health center there?
Oh, absolutely. I mean, this has been a game changer. This has been an absolute game changer. And so I think the long-term goal for us is we would like to be able to hire a permanent behavioral health consultant. I'll define a couple of things, right? I say IBH a lot. Again, that's for, integrative behavioral health. But the counselors that actually work within that model are called behavioral health consultants. Sometimes people are more receptive to that verbiage than seeing a counselor per se. And again, the model is not to replace regular individual counseling. That's not the goal here. The goal here for IBH is to offer immediate, quick behavioral intervention that hopefully results in a positive improvement in mental health. But again, maybe 2 to 3 visits. The visits are 30 minutes. They're not 1 hour. This is not meant to be long-term continuity of mental health care, but maybe 2 or 3 visits, quick intervention. So we have to be very careful too. As medical providers, we need to be able to refer the right people to IBH, because there are folks that do not need that. They need traditional long-term individual counseling. And so and sometimes the BHCs can help us too. They can help us. Sometimes they'll initially take an assessment, and there's feedback with the patient that perhaps they might benefit from more long-term individual counseling and need a little bit more than what IBH model can offer.
And so it's really interesting to see how you guys have integrated this within the college community there, and to see it as a model in a lot of ways for other college campuses, I'm sure. And the approach is unique, but at the same time so needed. And it is something that you think will happen in primary care across the country, or is this just kind of a trend that you see within the college community?
Oh, no. This is primary care across the country. But we both know mental health resources across the country are very, very limited, right? And so sometimes it's just hard enough to get someone connected for long-term individual counseling, much less have a BHC and an IBH program. So, we're lucky that we're on a college campus. We have a psychology department. We have a leader and a faculty member who has a lot of expertise in this model that's helped guided us. And we have grad students that are interested in learning about it. So, that's ideal. But I know that they have similar models. I know here locally at the community clinic, they have, these are behavioral health consultants that are hired. This is a full-time job for them. But again, they're housed within the medical clinics. I mean, our BHC's offices are just down the hallway from me, right? I mean, they're just a couple of offices down. And, but it is amazing for the patient because you're not just, addressing the physical complaint. I mean, you are trying to establish a comprehensive approach, address all of the issues, because if you improve the mental health, sometimes the physical symptoms just get better, right? And so if we don't do that, then, sometimes that just can be a long-term frustration for the patient. The symptoms aren't improving, but again, we're not really addressing all factors that could be contributing to the problems.
Well, Dr. Sharaf, I appreciate the time that you've given us today in talking about this. And I think that the work is much applauded that you're able to do there at the University of Arkansas. And so thank you. Thank you for giving your time to us.
My pleasure, Robin. Anytime. Thank you very much for inviting me and giving me the opportunity to talk about this resource.
And that's it for this episode of AFMC TV. Have a great day, and thanks for watching.